Hi everyone, welcome to I Love Pharmacology. In this session, let us learn about the drugs which are controlling the bladder. Myself, Dr. Padmanabha, TS, welcome to drugs which are useful in controlling the bladder. So, drugs which are controlling the bladder, we have a muscarinic antagonist. Means these drugs blocks the muscarinic receptor which are present on the detrusor muscles. Example is oxybutynin, we have tolterodine, we have sulfenacin, etc. So mechanism of action of these muscarinic antagonists is they block the M3 receptor in the detrusor smooth muscles which are present in the urinary bladder. The smooth muscle which is present in the bladder is called as detrusor smooth muscle. So by blocking the M3 activity, you're going to relax the detrusor smooth muscle activity, thereby it decreases the detrusor contraction, thereby in turn there will be decrease in the detrusor overactivity, thereby where it can be useful. So bladder will be relaxed, bladder capacity will be enlarged, it can be used in case of urgency incontinence or urinary incontinence. Next we have a sympathomimetic agent. These are the drugs which will going to stimulate the beta-3 receptor which is present on the detrusor smooth muscle. The example is Mirabegron. So Mirabegron is a beta-3 receptor agonist. It will going to activate the beta-3 receptor on the detrusor smooth muscles in the bladder, thereby it relaxes the bladder. So what happens when the bladder get relaxed? So there will be increased capacity of urinary retention. So that means to say there is a bladder capacity will be increased. So again, this drug, since it expands the capacity of the bladder, it can be used in urgency incontinence or urinary incontinence. So two kinds of drugs can be used in case of urinary incontinence. That is, one is the muscarinic antagonist and one more is the beta-3 receptor agonist. So you can use antagonist and agonist. Please don't confuse antagonist with respect to the muscarinic receptor and agonist with respect to the beta-3 receptors. Next we have a muscarinic agonist. So muscarinic agonist means these drugs will going to activate the M3 receptor present on the detrusor smooth muscle. Thereby it will going to contract the detrusor smooth muscle, thereby it increases the bladder emptying. The voiding frequency will increase. So where you want to use such type of actions? So whenever there is a urinary retention, in case of post-operative urinary retention, so you can use muscarinic agonist. The example is Bethanechol. So next we have a alpha-1 blockers. The example is Tamsulosin. So Tamsulosin specifically blocks the alpha-1A subtype receptor which are present on the trigone of the bladder, that is around the neck of the bladder and as well as in the prostate. So once you block the alpha-1 receptor which is present in the trigone, that is a sphincter, around the sphincter you have a alpha-1 receptor, that is a trigone of the bladder or the neck of the bladder, you have got predominantly alpha-1 receptor, and also the prostate will have a alpha-1 receptor. So by blocking the alpha-1 receptor, you're going to relax the neck of the urinary bladder, thereby it decreases the urinary obstruction. So urinary outflow obstruction will be relieved. So therefore it will be useful in case of elderly male patient who are having benign prostatic hyperplasia, where they will have a very difficulty in passage of the urine. The frequency will be more, even though they go to the toilet, they will not be able to void the urine because of the obstruction caused by the prostate towards the bladder neck. So whenever the prostate grows, what happens? It will going to contract, it will going to press the neck of the bladder, thereby the obstruction will be there for the passage of the urine. So let us have a simple recall. So you can test it yourself. So just we'll wait for 10 seconds and just recapitulate whether you can remember muscarinic antagonist and their actions, on which are the receptor which is responsible and where it is useful. Yes. So it is a M3 receptor blocker, relaxes detrusor smooth muscle, decreases detrusor overactivity, urinary incontinence is the use. So one more drug which is useful in urinary incontinence will be your Mirabegron. That will have a different action, that is, it stimulates the beta 3 receptor on the detrusor smooth muscle, thereby it relaxes and increases the bladder capacity. Next, coming to the muscarinic agonist, how it will going to act and where it is useful. So muscarinic agonist, we have a M3 receptor agonist, that is Bethanechol. It will going to contract the detrusor smooth muscles, which are helpful in case of conditions associated with urinary retention. Next, we have a very important drug, that is alpha-1 blocker Tamsulosin. Where do we use Tamsulosin? Tamsulosin is basically a inhibitor of alpha-1 receptor, which are present on the bladder, neck as well as the prostate. Thereby it will going to relax the obstruction which is done by the prostate hyperplasia. So it can be used in case of BPH. Again, a simple image understanding of the drugs can be very useful in terms of remembering these drugs for a longer duration of time. So picturizing or image-based learning will going to help you to retain the pharmacological concept for a long time. So can you guess the image and the drug? So drug must be, so it is avoiding the passage of the urine. So where do we require avoiding passage of the urine? Whenever there is a urinary incontinence. So we have two drugs, that is the M3 receptor blocker Oxybutynin and beta 3 receptor activator, that is Mirabegron, will going to relax the bladder, thereby it can be useful in case of urinary incontinence or urinary urgency. Next, we have a drug which is very useful in case of voiding the urine whenever there is a retention of the urine in case of post-operative patients. So we have a Bethanechol which will going to stimulate the detrusor muscle by activating the M3 receptors. Next, we have an elderly male patient who is having very difficulty in passage of urine, and the stream of the urine will be very slow, and there will be pain, and there will be difficulty in passage of the urine. So condition will be benign prostatic hyperplasia, where you are going to use a alpha-1A receptor inhibitor or the blocker, that is Tamsulosin. So hope you must have enjoyed this session. We'll come out with the next topic with a unique understanding with respect to the concepts in pharmacology. Thank you.